Heart failure does not usually begin with a dramatic collapse or a sudden emergency. In most people, it starts quietly with changes that feel small and easy to ignore. These early signs appear in daily life and are often blamed on age, stress, or lack of sleep. The heart is a muscle that pumps blood to deliver oxygen and nutrients to every organ. When it begins to weaken or stiffen, it cannot pump efficiently and the body starts sending warning signals. The tragedy is that many people notice these signals but do not take them seriously until the condition becomes advanced. One of the earliest and most common signs is unusual tiredness. This is not normal tiredness after work, but a deep exhaustion that does not go away with rest. Activities that were once easy, like walking up a short flight of stairs or carrying groceries, begin to feel heavy and draining. This happens because the heart cannot pump enough oxygen-rich blood to the muscles, and the body responds by conserving energy. Another early sign is shortness of breath, especially during routine activities. At first, it may only appear when climbing stairs or walking fast, but later it can happen even while speaking or resting. Many people think it is due to poor fitness or weight gain, but in reality it can be caused by fluid building up in the lungs when the heart cannot move blood forward properly. A third sign is swelling in the feet, ankles, or legs. This swelling may appear at the end of the day and improve overnight. It happens because blood returning to the heart backs up in the veins and fluid leaks into surrounding tissues. Shoes may feel tighter and socks may leave deep marks on the skin. Over time, this swelling can spread to the calves and thighs and may also appear in the abdomen. Another overlooked sign is rapid weight gain over a few days. This is not fat gain but fluid retention. When the kidneys sense reduced blood flow, they hold onto salt and water, which increases body weight quickly. Gaining 2 to 3 kilograms in a short time without eating more food is a serious signal that fluid is accumulating in the body. A fifth early sign is persistent coughing or wheezing, especially at night. This cough is often dry or produces white or pink frothy mucus. It occurs because fluid builds up in the lungs when lying down and irritates the airways. Many people mistake it for allergies, asthma, or a chest infection and treat it with cough syrups instead of checking their heart. Another important sign is difficulty sleeping flat. People may find they need extra pillows to breathe comfortably or wake up suddenly at night, gasping for air. This happens because when lying flat, fluid shifts toward the lungs and makes breathing harder. Sitting up allows gravity to pull some of that fluid away from the chest and brings relief. A seventh early sign is loss of appetite and nausea. When the heart cannot pump efficiently, blood flow to the digestive system decreases. This can cause bloating, a feeling of fullness after small meals, and a general loss of interest in food. Some people feel sick or have stomach pain without understanding that the heart is the root cause. Another warning sign is confusion or difficulty concentrating. The brain is very sensitive to changes in blood flow and oxygen levels. Reduced circulation can lead to memory problems, dizziness, and a sense of mental fog. This is often blamed on stress or aging, but it can be linked to heart function. An additional sign is increased heart rate or palpitations. When the heart weakens, it tries to compensate by beating faster to deliver enough blood to the body. This can feel like fluttering, pounding, or racing in the chest. It may happen during activity or even at rest. Some people feel irregular beats that come and go. Another sign that is frequently ignored is reduced ability to exercise. People notice that they cannot walk as far as before, or they need to stop more often to catch their breath. Muscles feel weak and heavy because they are not receiving enough oxygen. Over time, physical activity becomes more difficult and people start avoiding movement, which worsens the problem. Another early sign is frequent urination at night. When lying down, fluid that has collected in the legs during the day returns to the bloodstream and is filtered by the kidneys. This leads to increased urine production during sleep and repeated trips to the bathroom. Many people think this is just part of getting older, but it can be related to heart failure. A 12th sign is chest discomfort that is not sharp pain, but a feeling of pressure, heaviness, or tightness. It may occur during activity and ease with rest. This can indicate that the heart muscle is not receiving enough oxygen or is under strain. While chest pain can have many causes, any persistent discomfort should never be ignored. The 13th early sign is cold hands and feet. Poor circulation caused by reduced pumping ability can lead to a feeling of coldness in the extremities. The body prioritizes blood flow to vital organs and reduces supply to the skin and limbs. This can make hands and feet feel cool or numb, even in warm conditions. These signs do not usually appear all at once. They develop slowly and can be mild at first. That is why they are often dismissed. People assume they are simply getting older, out of shape, or stressed. The danger lies in delay. Heart failure is a progressive condition, and early treatment can slow or even prevent worsening. When these signs are ignored, the heart continues to weaken and more severe symptoms develop, such as extreme breathlessness, severe swelling, and repeated hospital visits. Understanding why these signs occur helps people take them seriously. The heart works as a pump that moves blood through a network of vessels. When it becomes weak or stiff, blood cannot move forward efficiently. Pressure builds up behind the heart and fluid leaks into tissues. At the same time, organs receive less oxygen and nutrients. The body activates hormones that cause salt and water retention, which increases fluid load and further strains the heart. This creates a vicious cycle. Risk factors such as high blood pressure, diabetes, obesity, smoking, and a history of heart attack increase the likelihood of developing heart failure. Long-term stress, poor diet, and lack of exercise also contribute. Many people with these risk factors live for years without symptoms until the heart begins to struggle. That is why routine checkups are important. Blood pressure measurement, blood tests, and imaging can detect early changes before symptoms become severe. Lifestyle plays a major role in both prevention and management. Reducing salt intake helps prevent fluid retention. Eating a balanced diet rich in vegetables, fruits, whole grains, and lean proteins supports heart health. Regular physical activity strengthens the heart muscle and improves circulation. Quitting smoking and limiting alcohol reduce strain on the cardiovascular system. Managing stress through sleep, relaxation, and social support also protects the heart. Medication may be necessary to control blood pressure, regulate heart rhythm, and remove excess fluid. These treatments are more effective when started early. Ignoring the early signs does not make them go away. Instead, the heart works harder and becomes more damaged. People often wait until they experience severe breathlessness or sudden swelling before seeking help. By then, the condition may be advanced and harder to control. Awareness of subtle changes is key. A person who notices that walking to the market feels harder than before or that shoes are tighter should pause and consider the possibility of a heart problem. A persistent cough at night or waking up short of breath should not be brushed off as a cold. Rapid weight gain over a few days should not be blamed on overeating. Each of these is a message from the body. Listening to these messages can save years of life and prevent suffering. Heart failure does not mean the heart has stopped, but it does mean the heart is struggling. With proper care, many people live long and active lives. The first step is recognizing the early signs and seeking medical advice. A doctor can perform tests to evaluate heart function and determine the cause of symptoms. Treatment plans are tailored to the individual and may include lifestyle changes, medication, and in some cases, devices or procedures. Education empowers people to take control of their health. Knowing that tiredness, breathlessness, swelling, cough, sleep problems, appetite loss, confusion, palpitations, exercise intolerance, night urination, chest discomfort, and cold extremities can be linked to heart failure allows earlier action. These signs appear in daily life, and that is why they are dangerous. They blend into routine and are ignored. Paying attention to the body and responding early can prevent complications. The heart is central to life, and when it begins to fail, the entire body is affected. Respecting early warnings is an act of self-care. When people understand that small symptoms can reflect a larger problem, they become more proactive. Instead of waiting for a crisis, they seek guidance early. This approach leads to better outcomes, fewer hospitalizations, and improved quality of life. The message is not to live in fear, but to live with awareness. Changes in energy, breathing, swelling, and sleep are not just inconveniences. They may be the first whispers of heart failure. Acting on these whispers can stop them from becoming a shout that can no longer be ignored. Don't keep this health secret to yourself. Like, share, and subscribe for more life-saving information.